arrhythmia is an abnormal heart rhythm. This may be noticed by the patient in the form of palpitations or the heart racing. Sometimes arrhythmias may not be noticed by the patient as well. As mentioned, sometimes if the arrhythmia is prolonged or if the heart is going quite fast, the patient may notice symptoms of the heart beating in a funny way. They may notice a fluttering of the heart. They may notice the heartbeat skipping a beat. They may notice a thump in the chest or a very pronounced heartbeat. Sometimes the arrhythmias, if they are very fast or very slow, can cause dizziness, lightheadedness. Patient may even collapse or lose consciousness with an arrhythmia. The majority of arrhythmias are usually benign in that they are not particularly serious. These are sometimes due to different electrolyte changes in the body, so the different salts in the body, if they are slightly out of balance, can cause arrhythmias. Sometimes external agents such as coffee, such as stress, alcohol can cause arrhythmias. You can also get palpitations, which is a feeling of the heartbeat when you are stressed or when you are worried or when you are anxious. Now, most of those ones I've described so far are the benign or the arrhythmias which are not really that significant. Alongside that, you have significant abnormalities in the heart rhythm, which are the more serious arrhythmias. Now, these are caused by an abnormal wiring in the heart. So the heart has an electrical system which carries the heart impulse from different parts of the heart to the other part of the heart. And if this electrical circuitry is abnormal, if there is a problem with the circuitry, extra wires in the circuitry, as it were, this can then cause these arrhythmias. So the patient will often come to a healthcare provider saying that they've noticed the heart racing, or they may come as a first presentation with a collapse. In that situation, the best test is an ECG, which is just a few stickers, 12 stickers on the chest, which within a few seconds produces a piece of paper, which gives us a very quick idea about the electrical activity in the heart. If that is abnormal, then we may be able to make a diagnosis. Sometimes we may need to monitor the heart rhythm for a longer period, such as 24 hours, 48 hours, or even for a week. We usually do these with small patches which we place on the chest, and we also ask the patient to keep a record of any symptoms they have, as we can then correlate those symptoms to any abnormalities on the monitor. We may even monitor the heart for a long period of time, such as even a year or 2 years, by putting a device in under the skin in a very small procedure lasting around 15 minutes. The reason for this is we may want to monitor for a prolonged period of time if the arrhythmias or the palpitations are very infrequent, say once every few months only. So it very much depends on the nature of the arrhythmia. As I mentioned, there are the benign and then the more serious arrhythmias. The benign arrhythmias often can be treated just by reassuring the patient that there is no serious rhythm abnormality. Sometimes they can be treated with drugs such as beta blocker tablets just to stabilize the irritation to the heart. Sometimes the treatment is with lifestyle, so decreasing the amount of caffeine or decreasing the amount of alcohol, losing weight can significantly decrease the arrhythmias, decreasing stress, changing certain workplace behaviors or patterns can help with that. Now, if the rhythm is one of the more serious types of rhythm abnormalities, we often try to manage these initially with medications to suppress the abnormal rhythm. If the medications don't work, then there are different ways in which we can treat them. We often do procedures called ablations, where we give some local anesthetic in the leg, put a tube up to the heart, and remove the extra abnormal electrical tissue. This is a very safe procedure and normally takes around 1 to 2 hours. The patient can have that under local anesthesia or general anesthesia if the patient wishes. With most of these procedures, the cure rate can be between 70 to 95%. So if they are the benign type arrhythmias, the outlook is very good. These are not associated with any significant mortality or morbidity at all. If the arrhythmia is one of the more serious ones, usually depending upon the type of arrhythmia, there may be certain side effects. So one of the arrhythmias, atrial fibrillation, is associated with stroke. What we do is thin the blood with medication tablets to try and prevent the risk of stroke. Some of the other arrhythmias can cause loss of consciousness, and some of the very rare arrhythmias are also unfortunately associated very rarely with death. In those situations, we put special devices in, special types of pacemakers, to give the patient a shock from the device to bring the heart back into the normal rhythm. Fortunately, the likelihood of requiring such a device is actually very rare.